Welcome to our video on code gray activation. This video has been brought to life with the assistance of artificial intelligence, AI. Sit back, relax, and be captivated by the power of AI as we present this tutorial. Code gray is an important emergency response protocol used in our hospital in managing violence towards healthcare workers. According to the Guidelines for Managing and Preventing Violence Against Healthcare Workers by KKM, violence refers to any behavior involving physical attacks, verbal threats, sexual harassment, or written communication intended to harm, cause damage, or inflict psychological harm on the victim. Code gray is an emergency code that activates a well-trained and professional team to respond and handle any harmful incident, or potentially harmful incident, to ensure the safety and well-being of healthcare staff, as well as others. Today, we will go through step-by-step managing violence towards healthcare workers according to the code gray flow chart for Sungai Buloh Hospital. Whenever any violence or a threat occurs, the local response team shall take charge. The local response team may consist of staff nurses, sisters, medical assistants, house officers, medical officers, and local security guards. The local response team's primary goal is to manage the situation safely, and attempt to diffuse possible tension before needing to escalate to the code gray team, all while staying within their negotiable offers. From here, let's explore the three possible outcomes that may arise. First, situation resolved, or negotiation successful. The local response team successfully resolves the situation through de-escalation techniques. Following this, the patient or assailant is referred to a psychiatrist or psychologist if necessary. Critical incident stress debriefing (CISD) sessions are conducted, notifications are made, and an investigation of the incident will take place. Second, local response team unable to manage situation. If the local response team is unable to handle the situation effectively, it is time to activate code gray. This ensures that additional resources and expertise are mobilized to address the escalating situation. Third, weapon involvement. If the patient or assailant escalates to using a weapon or threatens to use physical violence, code black is activated, signaling an even more serious threat requiring immediate action. Now, let's focus on the steps involved in activating code gray. When a violent situation arises and the local response team is unable to manage the situation, they should immediately call the designated emergency number, 1010. Inform the operator about the incident and request the activation of code gray. Relay these information to the telephone operator. The code color, code gray. The location of the incident. This information is vital for a prompt and effective response. Subsequently, an announcement is made via the hospital's PA system, alerting the code gray team members. The team includes the matrons, Penelia, and specialists from the affected area, the psychiatry team, occupational safety and health team, and the security officer. The code gray team promptly arrives at the scene to de-escalate the situation. Their expertise and coordinated efforts shall aim to restore safety and order within the hospital. The code gray team has a higher authority to address the assailant via negotiations. Just like the local response team, the code gray team can encounter three possible outcomes. First, situation resolved. The code gray team successfully de-escalates the situation, leading to a safe resolution. Notifications, CISD sessions, and referrals to a psychiatrist or psychologist for affected staff are made as necessary. Second, code gray team unable to manage situation. If the code gray team faces challenges in managing the situation, it's time to escalate to the highest management team for further intervention. Third, weapon involvement. If the patient or assailant upgrades to using a weapon or the situation escalates into a life-threatening situation, code black is activated. The highest management team consists of the hospital director, deputy hospital director, head matron, head of Penelia, head of department or consultants of the area involved, head of security officer, and the public relations officer. When the highest management team takes charge, the availability of options to negotiate with the assailant will be wider, and may involve decisions that are only available through the authority of the hospital director. They work alongside the code gray team to bring the situation under control. However, if the situation remains unresolved even after involving the highest management team, the Occupational Safety and Health (OSH) unit shall escalate the matter to the state level for further negotiations. A detailed report is furnished and sent to JKNS for further intervention and guidance. That concludes our video on Code Grey, an essential emergency response protocol in our hospital setting to manage violence towards healthcare workers. Remember, by properly activating Code Grey and involving the necessary teams, hospitals can effectively manage potential threats and ensure the safety of patients, staff, and visitors. Remember, clear communication, teamwork, and the implementation of established protocols are crucial in maintaining a secure and controlled environment. Thank you for watching. And stay safe.